Hi, I am Dr. Manohar, Urologist and Renal Transplant surgeon working at Manipal Hospital Sarjapur Road. So today I am going to speak about the prostate, which is the most common issue among the elderly population. So what is prostate? Prostate is a walnut organ which is just below the bladder. So what is the function of this? The function of the prostate is production of to increase the quantity of semen. So as men gets aged, so this is one of the most common problems they come across. So at the age of 60 years, almost 60% of the male will be having lower urinary tract symptoms, that is obstructive symptoms, because of prostate. The good thing is in this, if the patient develops symptoms of obstruction, majority of the time it will be because of benign growth of the gland, which happens as the man grows old. So we do come across prostate cancer, but which can be picked up either by serum PSA or the rectal examination. This is the way we can pick it up, and which can be proved by prostatic biopsy. The symptoms which you come across for the benign prostatic hyperplasia is the patient may come with a poor stream, hesitancy, or difficulty to pass urine, or increased straining, or increased passing of urine in the night. So these are the common symptoms which men do come across. So what are the treatment options left for benign prostatic hyperplasia? So initially in the earlier days they used to come across the conventional TURP, that is transurethral prostate resection. So that is done used by the electrocautery. But at present the gold standard technique which is coming up is HoLEP, that is holmium enucleation of prostate. So if you ask me that what are the advantages of HoLEP, we do have that the patient, if you look at the patient wise, it is ideally indicated in patients with poor cardiac reserve, the patients are on bleeding diathesis, or the patients are on blood thinners, because of late many of the patients will be on blood thinners, and we cannot stop the blood thinners because it will be affecting his cardiac system. So with the help of HoLEP, that is a holmium enucleation of prostate, we can as well do enucleation of prostate, that is the resection of the prostate, without even stopping the blood thinners. So post-operatively, what are the advantages in patient undergoing HoLEP? So the patient will be early recovery will be there. We don't use much of traction. So if you don't use traction post-surgically, patient will have less pain, and also early recovery. Almost all my patients, I do discharge the patient the same day in the evening or the next day, and patient's recovery also is very well, and they get back to work fast. So to conclude, I want to say that the HoLEP is the gold standard for the prostate surgeries. This is definitely makes the patient's life much easy and much early recovery, and get back to work as soon as possible.